Dr. Willis, it's a pleasure to be here with you today.
Likewise.
This amazing backdrop, the clouds in Geneva at this beautiful place. So here you are as the medical director. And what are some of the kind of patients that you see when they come on over here with different addictions? And when you look at society as a whole, you mentioned change in culture is one. That's a very valid point. I didn't think of that. But when people come today, what's changed over the last couple of years? Are you seeing a change in the kind of addictions in human behavior? I would love to know that because everyone looks at addiction with a very different perspective.
Sure.
Some people just look at alcohol and drugs,
Yeah, I see.
but it's way beyond that. Today we have people with addictions like gambling, but they don't think it's an addiction, or over socializing, over shopping, sex, and so many little things. But most perspectives are, oh, you're an alcoholic or you're a drug addict. And people fail to introspect about what their possible red flags are that they may have in their life path.
Okay, that's an interesting point. I was at a big medical meeting. Maybe this is something we should also note. I am president of the French-speaking part of Switzerland of the Hypnosis Institute, because with all these, say, phenomena in the body that are pathological, I was interested in different types of body mediation therapies. I've written several articles on body mediation therapies, and I specialized in hypnosis and psychoanalytical relaxation therapy. And the reason for that is that I noticed that today's postmodern society, or post-postmodern society, they say, or some say post-truth society, but that's another discussion. People are very frustrated compared to several decades back. I find there's a lot of tension in society right now. The world is not doing very well right now in a general sense. I can have this stepping back phenomenon and look what's going on in the world, because I've been practicing psychiatry now for 31 years. And we have to say this, I'm a boomer, as my children say. And I do see the world with a certain retrospective sense that things have changed. When I was an adolescent, there was television. That was it. I saw the arrival of computers, personal computers, cell phones, and now there's addiction to internet. And the big phenomenon that I can use to describe that is that people now have a very low tolerance to frustration. And people are expecting immediate gratification of frustration without having to work hard to get to it. And what we've noticed is that people have lost the spiritual depth in life, and they're on the surface looking for satisfaction to frustration and trying to get gratified immediately from different difficult situations, not taking their time, not slowing down, not having this stepping back look at the world, but wanting right away to jump into things and solve the problem. And the inconvenience with that is that you have this debt that is slowly introduced afterwards, because you're not taking care of the problem. You're always trying to smooth it over, to avoid it. You sweep the dust under the rug, and the rug gets lumpier and lumpier, and eventually when you walk over the rug, you trip. And this is what we feel here at Clinically Alp is the core of the work to be done, to stop, to sit on this mountaintop, to look out to the mountains that unfortunately we can't see today because it's a bit overcast, but to just say, what is going on in my life? Why am I here? What is going on? How can I stop this?
You speak about this depth, this shallow depth. Do you think one is a lack of spiritual roots, one is a lack of purpose, and that's why people are constantly trying to, instant gratification? You also mentioned a beautiful word, free will. Do you think free will be mismanaged with this depth, the shallow depth that people have within them? Because then they have an easier choice. It's free will. We can constantly choose the easy way out. People don't want to put in the work. They don't want to do the work. They don't want to have to face fears, face things in their past, which can actually, probably build a better present and future for them.
Sure.
So what's your take as a psychiatrist when it comes to free will, or maybe first filling up these voids, giving people the tools to connect maybe to nature, connect to a purpose, reconnect with family, a meaningful relationship. And then, of course, free will becomes something that we can all connect to. I would love your approach on this and how you would handle it, especially in today's world, with that shallow depth that you spoke about.
Every morning we have a medical meeting, but in collaboration with what we call the Body Mind Source Unit, which is essentially physiotherapists, complementary therapists, a fully equipped gym, swimming pool, jacuzzi, steam baths, but where everything is supervised by health coaches, sports coaches, and life coaches. All these people are in the medical meeting in the morning, and in the afternoon, there's all the staff, hospitality, different people from the outsourced unit sometimes come in and will share what's going on with the patient, people that come in for complementary therapies. And sometimes it's just one of the people from the hospitality service that'll notice that in the trash bin in the patient's room, there were some empty blister caps for Xanax. And it's like, whoa, something's going on. And then we have to pick up with the patient, confront, see what's going on. So we all work together. It's not just a doctor deciding or a medical director or a general director. We're all on the same level, sharing our experience together and trying to find for the patient. And what that allows is this multi-concentric model for treating patients. Let's say the nucleus is general medicine, internal medicine, and psychiatry and psychotherapy. This is the hard center, if you wish. On the outside of that is the circle of the complementary and alternative therapies. We have between 20 and 25 different types of complementary therapies that we apply here. And I've gone through every type that is employed here to make sure that there is evidence-based proof that it's efficient. It's not just wellness or rearrangement of your energies or things like that. Those are included, but I've made sure that there's been university scientific studies showing that they do have efficiency against depression, anxiety, and withdrawal symptoms from different addictions. So we work with those in the outer layer. And then beyond that, there's perhaps the social, psychosocial, psychoeducative domain where we will confront a patient. For example, for addictions, we use the Minnesota method, that is the 12-step method that's been medicalized for patients that was first of all done with Alcoholics Anonymous, but afterwards applied to all addictions and even eating disorders or just anxiety. It can be used in many different domains. We use that, we use motivational interviewing techniques, and then of course, conventional psychoanalysis, CBT, systemic family therapy, and then all the complementary therapies combined. Hypnosis is sort of the, let's say, the joint between the two. It is medical, but it is also complementary in approach. And we use all these approaches to make a patient realize that either his mental illness, his addiction, is like this monolith that is unconfrontable. You can't touch it. If you come in headstrong saying, you're an alcoholic, you're an addict, and you have to stop, and you have to do a 12-step meeting every day, 1 out of 2 patients are going to say, I'm out of here. That's perhaps the finesse that we have to work with here. The next step that we work on with them is that something has to be done, because some patients will say, yeah, I'm depressed, but I don't care. I'm going to contact exit and end it all because life is meaningless. No. We say, stop. There's other things in life than that. Or an alcoholic says, yeah, I drink, but who cares? Everybody drinks. It's no problem for me. To make them realize that it is a problem. And secondly, that something has to be done. You can't just stay like that because you'll be miserable after years of use or mental illness. And the third thing that usually we have to work on with patients, some don't want to, and we do accompany them, but is to realize that you can't do it on your own. You need the community. You need different groups, self-help groups, sponsors, Alcoholics Anonymous, Cannabis Anonymous, Cocaine Anonymous, Eating Disorders Anonymous. There's hundreds of different units with this model that are worldwide and available 24/7 online with meetings every other day or every day in person where you can go and meet people. This community helps you really change your life and remain abstinent and in recovery. There's self-help groups for people with depression, anxiety, other forms of mental illness, and for families. That's perhaps another important point. We work with the families. That's another layer, the family. We very often have family sessions at the end of a stay for patients here where, let's say after week 3, we'll have patients come in for another week or two. We'll have a patient's family come in for another week or two, Monday, Wednesday, Friday, to do a big family session and see what's going on in the family. Is the family suffering from that? And also to keep this, let's say, line of thought going on with the patients and the family, in the aftercare that we set up, usually in the middle of the stay, we're going to confront a patient and say, okay, what are you going to do when you leave? And some will say, well, just pick up as before, you've cured me. We say, no.
Mm-hmm.
You don't get cured from, let's say, dependencies. They'll always be there and they'll always be lurking, ready to pounce on you again. Mental illness, schizophrenia is very difficult to be cured from. I have some colleagues that profess that it can be done, but for me, it's something that you adapt and deal with.
Mm-hmm.
You adapt to it and deal with it. Anxiety disorders, depression, they can go away, but they can always be lurking, and relapse can be a danger in the future. So what we do with patients is we say in the middle of the stay, okay, do you have a psychiatrist? Do you have a psychotherapist? Do you have a GP? Do you have a group that you go to for self-help? Do you have, for example, patients where we work on the microbiota here and their diet and their nutrition? Do you have a personal chef that does your cooking for you, that makes sure that you're eating correctly? Are you doing regular athletic activity? Do you have a sports coach, a life coach? We go through all these different details, and if they don't, we help them set that all up with our worldwide network of colleagues and contacts to make sure that when they leave, relapse is at least kept more at bay than if there was nothing there.
I love the fact that you'll have the aftercare in place, because a lot of clinics that we've seen before, the patient leaves and then they're on their own, they're lost. Mm-hmm. They usually have to come back and restart treatments. I like the fact that you're extending out that help wherever they are in the world to continue that.
By all means.
Yeah.
And this is another point. You reminded me. When the patient leaves, we say, okay, we're going to call you, their lead counselor. They have a lead counselor during their whole stay here. Their lead counselor will call them when they've left the clinic on week 1, week 2, at the end of the month 3, month 6, and at the end of the year. And say, where you at? How you doing? Just to check in, to see if everything's okay. And during this year, and sometimes afterwards, patients are invited to come back for what we call a booster stay. Mm-hmm. So a booster stay is where you have to come back asymptomatic or lowly symptomatic for depression or anxiety, sober for addictions, or non-dependent, let's say, and not in active use. That's a better way to phrase it. Where you come in and you go through the therapies, you benefit from the body-mind source unit, you go to the spa, you relax, you meet the therapist again, all the different staff, and mainly you share with other patients how you've gotten out of the woods, how your problem has been solved, and what solutions you've found. And first of all, I always say to patients, that gives a light at the end of the tunnel for the newcomers that are desperate, that think that their life is over, that they see no way to get out of their mental illness or addictions. And most importantly, sharing that and seeing the patient's eyes widen, saying, there is hope, that reinforces the patient's recovery that's come back for the booster stay. They realize that sharing is something that makes you no longer want to go back there even more. So this is something that we do insist on with aftercare. Of course, if patients relapse, they can come back right away, but we do insist, it's not obligatory, but we do insist on a booster stay within the following 3 to 6 months of treatment. And of course, we do have patients that come back every year just for a little reminder to keep on track, to make sure their life is healthy and to do a checkup. But the general treatment is, for example, 28 days for depression, anxiety, alcohol. Polyaddictions is a little bit longer. It's more complicated if a patient comes in using many substances and with comorbidities of depression and anxiety. But during these 4 weeks, we'll detox the patient for the first week to 10 days. They'll be in an acute room where they're very close to the nurses. With our medical meetings every day, we decide when they can go to the subacute rooms that are down the hall, but more posh, but farther away from the nurses, so less secure. And as they see they're graduating to a better state of health, they go up to what we call the chalet, which are the very nice rooms with a view of either the lake or the mountains. And that lets them see their progress.
What I really loved when I was speaking to your dietitian, how much she focused on the gut. The whole gut, the HPA axis, and the depth of getting into your whole microbiome and trying to figure out the connection with, your brain, your functioning, your addiction. I love that holistic approach because, I completely believe that we can't just look at addiction as a symptom. We need to get to the root cause of it. And it just couldn't be counseling alone, but it's also your diet, the kind of foods that have impact on your brain, on your thinking, on your own sense of purpose. I know so many people who have gut problems back because a lot of our patients go through chemotherapy and kind of depletes a lot of their gut bacteria. And we notice how their moods immediately change and how things that they were never negative about, they start to get so negative about it. And as you start to, repair their gut, put in the right foods, the right fibers, the right pre and probiotics, their moods instantly change. And that's an amazing connection between the gut and the microbiome. And I'm so happy that you'll look into detail. I also noticed exercise. I had a session yesterday, and never in my life have I had someone assess me in such a holistic way and just break it down into 2 stretches that I need to do. That's it. Just 2 stretches over and above everything else that I'm doing. And he broke it down with simplicity and science, and he told me how it would even affect my mood. And I reflected on it because when I get that little tug, not really a pain on my QL, I immediately have these thoughts in my mind that, oh, how am I going to sit on a long flight? I have a sitting job with patients. Is this going to come in the way? And he said, that's why we need to correct these problems at the root cause. It's not just for your movement, but it's for your mind. And I love that all of these patients, these clients are going through that holistic measure and that approach at the clinic over here. You're medically licensed as well, which is fabulous. And that's what kind of surprised me, because you have a medical clinic which is hardcore on the symptom and medication and psychotherapy and psychiatry, but here you'll have this whole holistic approach with the body, mind, souls, and everyone talking about the patient and everyone coming in with different ideas for the betterment of the patient. Whose idea was this? Is this something you've built along the way with experience, or is it something that, because this should be how all diseases are treated, not just the mind, but even people who have lifestyle diseases in a holistic way.
Yes, I think that does come, I have to admit, from the owner of the clinic. My first conversations with him were fascinating, and I retained one sentence that I think is really the basis of our treatment here, is that we're a one-stop shop. That is, if you come in here, you have a medically licensed, public health certified establishment. It's not just a medicalized hotel or some wellness unit. We are like a clinic. We are a medical clinic. We are like a hospital, I meant to say. We're like a hospital. So there's doctors, psychotherapists, nurses that take care of the patient. That's the central core of my multi-concentric circle model of the holistic approach to a patient. And so if a patient comes in severely alcoholized with 3 or 4 grams of alcohol in his blood, we're not going to send him off to the general hospital to be detoxed. We do it here. Of course, if there's a life-threatening situation, we'll helicopter him to the university hospital immediately. We've done that, I think, on 1 or 2 occasions, 1 for sure. But if we can manage it, which is usually the case, we will do the hard medicine, and then we'll introduce all these different approaches. The patient will meet the dietitian. Those are the outer circles, of course, of my concentric circle model. But if you don't do that, you're missing something. So we have to have the consultation with the dietitian, the nutritional work. Our dietitian works with our 5-star French chef to make sure that it's very healthy food and very appealing, very good for you and very good to eat. Also for all the athletic activity, the sports coaching, those are outer circles that we work on. The circles continuing are the spiritual dimension that we spoke about previously, that will help the patient feel more balanced. We practice all these different techniques, philosophies, and approaches to help a patient find the best way to get to better health.
Doctor, you spoke about psychosomatic, and I could see your eyes light up when you talk about psychosomatic disorders. I want to go back to a patient I had a couple of months ago, and he had these pains all over his body. And the doctors did everything from MRIs to CTs. The blood work was good. The CRP levels, ESR, all the inflammatory markers were well below the range. And then we had him referred to a psychiatrist who just put him on a little antidepressant medicine. Every single symptom disappeared. Every single pain disappeared. Is this an example of psychosomatic in your case, where the mind has the ability to create its own problems and pains at a physical level?
I see. Okay. Yeah, this is very fascinating. Something I learned probably 25 years ago in my different frequentations of psychoanalytical societies in Paris. A psychosomatic disorder occurs when there's a lack of ability to deal with inner mental conflict. As I said previously, low tolerance to trying to find immediate gratification to frustration, trying to find immediate solutions to any suffering without knowing that you have to go down a long path to recovery. What happens there is when you can't do that, you have this stress, anxiety, depression, something that increases more and more, that coops up more and more. And finally, when the mind is no longer able to manage it, it overflows into the soma and becomes somatic. So too much tension and stress, when there's no more resilience, it overflows into the physical, and patients feel pain, which is easier to understand than frustration that your boss fired you, your wife left you, you have a mental illness, you have cancer, all these things that we can't deal with. It overflows and gives physical symptoms. One element that makes you able to see a psychosomatic disorder from a distance rather quickly is when it's not anatomical. It doesn't respect neuroanatomy. It migrates around the body and goes from place to place. When you treat one, it comes up somewhere else. That's because the root of the problem is not being taken care of. And you spoke of an antidepressant, low dosage that changed things immediately for the patient. I think that was a lucky situation because many patients come in loaded with benzodiazepines, too many antidepressants, and they have all the side effects, which creates more pain, and it's a vicious circle. We have a philosophy here of minimal, efficient dosage, or even in a first stage phytotherapy, using medicinal plants or other natural methods to work on anxiety, depression, and dependencies, then right away saying, take this antidepressant, it'll make you feel better. We try and very slowly go into that. And there are patients who come in here saying, I don't want any meds. And we'll say, well, you're taking alcohol. Isn't that kind of self-medication? And they'll say, oh. And so we do help them realize that there are medications sometimes that are necessary. But our goal is the minimal efficient dosage or no meds, where you deal with it yourself and you find solutions. Of course, if a patient has schizophrenia, the neuroleptic has to be maintained. If a patient has chronic depression, sometimes a low-dose chronic antidepressant has to be used. There's all kinds of situations, but in general, for me, people just have to stop these quick fixes and start looking for the long-term solution to their frustrations.
Doctor, I noticed in one of your programs at this clinic, you'll focus on sleep. You'll focus on deep sleep. As a psychiatrist over the years, what's your observation on the connection of sleep deprivation with our mental health, with our emotional health, and even addiction?
Okay, I can't give you the reference, but there's a new article that came out. I think it was in the New England. We were talking about that at our medical meeting last week. People with chronic sleep deprivation have degradation of their chromosomal telomeres. They start to fray out because lack of sleep is something that is very bad for the body. Medication, for example. This is why I'm in the philosophy of minimal dose medication for patients with psychiatric disorders. Medication perturbs the architecture of your sleep structure. You know, there's the 1, 2, 3, 4 stages of deeper and deeper sleep, and then the paradoxical sleep that happens between 6 and 9 times a night to make you have a normal sleep pattern. Patients that are on benzodiazepines don't have paradoxical sleep. I have many patients that come in on horses doses of antidepressants, and they say, Doc, I don't dream anymore. And if you don't dream, you can have long-term effects on your mental and physical health.
So your approach would then be to slowly work with them with these tools, reduce their medication by giving them support structures, whether it's food, whether it's, body, exercise, nature, and of course
this is to show you the horizontal organization of our unit. We have a nurse that came in, normally, quote unquote, it should have been a doctor, but a nurse came in saying, hey, patients are complaining about sleep patterns. And I went, ooh, could you develop that for me? And this nurse, brilliant man, he looked into all different types of problems with sleep. And he came back with a psychoeducative program for our patients that we make most of them go through if they're having sleep disorders, which includes sleep hygiene, For example, if you have a sleep disorder, don't drink coffee beyond 12 noon. Don't drink any stimulant drinks or stimulant foods. We have a whole list of foods like non-pasteurized cheese that is full of tryptamine that can keep you up all night, for example. It tastes really good, but you should have it not later than 4 in the afternoon. Don't have your television at the end of your bed. Don't have your cell phone on next to your bed. Don't have open windows where a neon sign is blinking on and off, or other I can't remember how to say that in English, but the little red lights.
LEDs.
All the LEDs, but on the computer, the screens, everything has LEDs now in our houses. Turn those all off if you want to be able to sleep. Don't have mirrors in your room because that'll make a little random light bounce all over the place and stimulate you. All these things to make patients start to wind down. We have a small little box that we lend to patients and that they can purchase if they wish, that has different programs of sleep induction programs. It's like an app that you can see on cell phones to relax or let go. But this is a little physical. It's not a connected device. It's something separate. So there's no, let's say, waves coming in to disturb you. But it either has relaxing music or different types of programs that they talk you through anxiety. They talk you into sleep. And it turns off automatically when you finally fall asleep. Yeah. We help patients with different preparatory exercises to be able to go to bed. And of course, hypnosis, mindfulness, other types of body mediation techniques that we show to patients to be able to lower their anxiety, start to wind down at the end of the day and not be in bed where the whole day is going through their mind, or the next day that they're anxious about. How to relax and just turn off for a moment and make that break that you need. If you don't have a healthy night's sleep, you're not going to you'll have mental problems and health problems in life. You have to be able to sleep correctly.
No, I love the clinic's focus on sleep over here as well. That's very important to us, just to kind of reset the immune system, that natural intelligence, harness it. I want to go back into hypnosis as well. A lot of people are afraid, obviously, they watch too many movies and stuff about hypnosis going wrong, or about the hypnotherapist getting into their subconscious mind and, changing the program. But you spoke about the subconscious mind as well. That's my favorite subject. Can you talk about a couple of your experiences where you've used hypnosis to actually help a patient probably reprogram the subconscious mind or work with a particular addiction or a behavior?
Of course. Perhaps the first thing to do is talk about the myths to demystify hypnosis. There's a lot of false beliefs. Hypnosis is the most ancient form of caregiver-patient relationship. If you go back to prehistoric times, there was always a shaman, a witch doctor. And you had the conglomeration of huts or primitive dwellings of, let's say, simian creatures or Cro-Magnons, other early forms of Homo sapiens sapiens that would be huddled in their little village. And then apart from the village would be the healer. And it was the first thing that we had to be able to help people. The healer, he knew different types of medicinal plants. He knew different types of treatments for ailments, splintering a broken bone, splinting a broken bone, for example. But the main thing that he did was to chant, to have the villager brought, and he would either be in a smoke lodge or in a cave or in a big tent, a big hut, and there would be smoke, and he would have the talisman with the bones and the little beads dangling on his staff, and he'd chant and put on a mask, and the villager would be fascinated, surprised, confused, and that's what would make him enter into a trance. A trance, which is what we use now in medical hypnosis, is a very focused, let's say, you've heard of tunnel vision?
Yeah.
A trance is tunnel attention. It's a very focused state of wakedness. You're not asleep, you're awake on one or a few objects, concepts, or ideas. And what you can do in this state of a trance, accompanied first of all by a therapist in hypnosis, is either change your perspective of things in your life that make you suffer, learn techniques and exercises how to deal with different symptoms, lower the intensity of symptoms, or even make them disappear. At a later phase, we teach techniques to do visualization of future endeavors that are going to be difficult. And this can help you repeat in vitro a difficult experience. So when you live it in vivo, it goes well. And finally, you can just do hypnosis as a meditative practice to recharge your batteries, to get strength back. Hypnosis is something that helps patients get back to that depth that is lacking. Maybe I could give you a good example with the cavemen we talked about before. You have your encampment. A saber-toothed tiger comes into the camp. Well, you take a pointed stick and you kill it. You have this superhuman strength because of the sympathetic nervous system, adrenaline, fight, flight, or fright. You fight the tiger. Or if you're in a thicket and the tiger comes in, you run as fast as you can. It gives you superhuman strength. I'm sure you've heard the stories of a woman with her child under a car and all of a sudden she leaps off the car. It's because of adrenaline. We need adrenaline sometimes. Back in prehistoric times, we needed it several times a day to be able to take care of the predators or other dangers in early times. But after that, there would be activation of the parasympathetic nervous system, acetylcholine, where the patient, let's say the caveman would go back to his cave, he'd lick his wounds, he'd heal, activation of many different neuromediators and let's say mediators of healing would be put into action. The body would recuperate, rejuvenate, and you'd be ready for the next attack. Postmodern society has artificial dangers. There's no more saber-toothed tigers. The last one is the fight, flight, or fright. The fright is where you have the tiger come into the thicket. You freeze with fear. You don't move, hoping the tiger's upwind from you. He doesn't catch your scent, and he continues his path. And you've also been saved by adrenaline. But now the tiger is your boss, breathing down your neck, saying, "I want that yesterday." Your income taxes. Enter on the computer, and I've spent too much. I've given everybody my credit card number. All these artificial anxieties and stresses that are not dangerous, but we've made them become that. That makes us stay in the sympathetic mode. Human culture right now, where we see more and more wars that are coming onto the surface of the planet, it's because we all have sympathetic hypertonus. We're always in that attack mode. And we're no longer taking these moments that were the longer moments back in prehistoric times to just relax, to be with community, to be with family, to exchange. Hypnosis, the state of a trance, increases parasympathetic tonus. It gets you into that healing mode, into that step back and look at the world mode, where you're no longer in this feeling of distress that something has to be taken care of or there's an immediate danger that's going to threaten your life. You're able to relax. And that's where, with different patients, you can introduce them into this technique. You can reassure them. As I said before, a trance is a state of being awake. You're not asleep, so you don't get stuck in a trance. That's just in the movies. You do not wake up from hypnosis. Another thing is, I can't say, go to the bank and bring me back all your money. That exists. That's only in the movies. You can't make someone do something they don't want to do.
Correct. Yeah.
So it's very important to understand that there are certain myths about hypnosis. There's nothing to be afraid of. It's totally natural. You cannot be influenced to do something you do not want to do. That's where free will exists. But the idea is, with the free will, the state of a trance, the psychoeducative work we do, the psychotherapy that we do, we make you have more information and more data to make the right choices. Because you can have free will to make the wrong choice. You can take drugs if you want or drink too much alcohol. But if you have more information seeing how that's going to destroy the quality of your life on a long-term basis, you'll step back and say no. And with your own free will, say, I don't want to do that. Even if people make you have peer pressure saying, come on, have a drink with us, or take a hit off this joint, or let's do a line of Coke, or let's go on the computer all day and just not do anything else and just hang all day. You'll have the free choice after what you have done here or in treatment in general with a holistic therapist to say, no, that's not a good choice. That's not the right fork in the path. That's not the right way to go down the path, not to take the wrong direction down when you come across a fork, to know which way to go, the high road or the low road. Where you have to work and it's harder, that's where that expression comes from, that's where you will authentically get to a real goal.
Well, I love how you explained the sympathetic and parasympathetic. In our line of medicine, which is integrative and lifestyle medicine, we know that all healing and regeneration can only happen once the patient is in the right system, which is parasympathetic. So one of the jobs is to bring him or her into the parasympathetic nervous system. Do you think nature works for that? Because you'll have amazing treatments, you'll have this whole concentric model, but every time I open the window, I step out, I'm like, you're nestled in the Alps with this nature. Mm-hmm. We know there's a 7.83 hertz frequency, which is the earth frequency. And that's why we have a lot of our patients who just change their environment, whether they have infertility issues and they conceive, or they move to a different place within nature, away from the city. And magically, they start to get better. They're still taking their meds, but they start to feel better. Whereas they're taking the same meds in the city and, it's just working at a chemical level, but that they don't feel good. So I know the reason why you'll have the clinic up here in the Alps, but what's your take on the connection of utilizing nature as a healing mechanism for us mentally, physically, and even emotionally?
Of course, that's with the model I was showing you, that's another facet of the approach we use, back to nature. When patients start to emerge from their, let's say, pathological state, be it anxiety, depression, or different addictions, when they are able to go outside, that's the first thing we look into, is a walk around the clinic grounds. And then a walk accompanied by a life coach or a sports coach, but higher up into the mountains, a longer path. We work with equine-assisted therapy. We have a therapist in I think it's the Freiburg Alps, about a half-hour drive from here, where it's in just a bucolic atmosphere. We have a Swiss farm with different farm animals, horses, getting back to nature, seeing different animals playing and frolicking, and then approaching a huge horse and seeing, of course, we always check if patients aren't allergic to animals or horses, but if they can come into that domain, to see the horse as a model of your illness, that it's a huge, dangerous animal that can potentially be harmful, but little by little you can tame it. We have patients start by cleaning the stall, for example, getting back to real nature, getting close to the animal. And the long-term goal, not obligatory, but is to ride the horse and to see that you have entered into harmony with nature, with a huge animal that's difficult to harness, but that in the end you can.
Doctor, with all of your experience, I know right now, anyone watching this, a lot of people are struggling between denial and acceptance. We know that when you're in denial, you're still in resistance. You can't really start to heal, but once you move from denial to acceptance, we're allowed so many more possibilities. We have actions that we can take. We've accepted it. As a psychiatrist, what are some of your tips for us to move from denial to acceptance?
Okay, it depends on how massive the denial is. I just participated in a seminar in France concerning denial and addiction. And with some people, especially the very powerful, very narcissistic, or very symptomatic patients, changing anything is out of the question. And you have to find a very subtle chipping away at this huge block way to introduce the possibility of change. Denial can be so massive sometimes that it can seem unapproachable. You have to very subtly, with tact, politeness, respect, make someone understand that it's in them, that we are not against them, we are not trying to control them, we are against the pathology that is possessing them. And to make them understand that we are allies against this thing that lives inside of them, and that we can help them slowly eliminate it. But if you come in on your big horses saying, listen, you got a problem, most patients are going to just brush you aside. That is, patients that come here saying, what are you talking about? I'll find someone else that can do a better job. And they don't understand that it's in them that things have to change. They can't have people change things outside for themselves.
Wow. So, doctor, I wanted to talk about you. You're physically fit, you're athletic. We were having a conversation this morning. And then there's this whole perception where in today's world, people love to put themselves into boxes or labels. Like you have the whole Gen Z box, the millennial box. Then you have the CEO box where, oh, we're too jet set, we're too busy, we don't have the time. We have doctors say, oh, I'm always on call, I can't look after my health. But when you take people out of these boxes, there are mentally and emotionally fit Gen Zs, millennials. There are healthy CEOs. There are billionaires who make time for their health. There are doctors like yourself who looks after themselves. They have time for health. Is this a form of denial? Because you can't generalize. We have pilots who say that, oh, we're traveling, we're jet lagged, we're changing our circadian rhythms. But then you have pilots who are also focused on their sleep and their health, and they're doing it the right way. So from a psychiatric angle, is this a justification that we kind of, give ourselves to justify something that we cannot do? Is it a sense of denial? Is it just a sense of unawareness and mindlessness? How do you see this? Because you're a medical director, you're doing it, I'm looking at you. I saw a lot of purpose in you. Like, you don't start your meetings unless you get your workout done. You have your evening routine in place. These are choices that you've chosen to have, which obviously reflects on your overall, ability to be who you are. So how do we look at this? Because it's so easy for people to walk in and say, hey, I'm the prime minister of the country. I don't have time for this. But hey, there are prime ministers of other countries who are fit and they make the time. So how do we handle this? How do you see this as something that we can change?
I refuse to be the doctor going to so many seminaries and practicing medicine so much that my wife and kids leave me, that I'm taking drugs to be able to be more efficient and present for my patients, and working all day and being up to date with the latest research. I read the research and go through it and have friends who tell me, ever heard about this or that? But I'm not going to be up till 3 a.m. every day trying to see what's been going on in the latest research to be able to be top notch and on the ball all the time. There are limits. And sometimes the patients will say, you've never heard of this? And I say, well, no, explain it to me. I can learn from you. And the patient, how can I teach a doctor? Says, listen, you can do anything. Let's just chat and I'll look into it afterwards. I'm always saying to myself, if I don't know about something, maybe it's for a good reason. To fill your mind with too many different researches and projects makes you confused when you see a person in front of you, and to have a clear mindset as to how to help them. I take things as they come, and when I feel that I'm taxing my systems or that I need a break, I'll say, hey, just negotiated with the director recently. I have to take an extra week off in June. I've accumulated too many hours. I need to recharge my batteries. And he was, you manage that by all means. I do believe that being healthy yourself, saying the shoemaker, we have an expression in French, I can't remember how to say it in English, but in French we say the shoemaker has the ugliest pair of shoes. I don't think that's a good practice. You should take care of your shoes yourself also. And my mental health is extremely important. My physical health is extremely important. To feel balanced and to share that with patients. As we said earlier when we were chatting in the hall, sometimes patients will say, well, doc, you're in really good shape. How do you do all that? And when they hear my age, they're like, what? And I said, it's because I live healthily. I don't indulge in unhealthy activities. I'll dabble maybe. I'll have a good meal. I'll have a bit of wine with my meal, but I won't have a couple bottles in the evening just to wind down. I have a healthy lifestyle. And patients see that, and they see that with all the members of our team here also. We have a very young, dynamic, except for myself, young, dynamic team. I'm hoping to be dynamic, but the youth is slowly going away. But everyone shares that with patients, and that motivates them. Especially the ones, of course, in the Body Mind Source unit, the sports coaches that come in. They're all models of physical health.
Doctor, I'm inspired the work y'all are doing over here and everything that you've put together with your years of experience, integrating nature, exercise, the body, the mind, sleep, medicine, spirituality. I think a lot of people shy away from spirituality because they don't want to offend people. But the way you are slowly integrating it into, people who come here, because I completely believe what you said, going back to the first point, when we're empty, we're not fulfilled. That's when most of the problems start. And we need spiritual roots. That could be nature. It could be God for someone else. It could be the universe for someone else.
Of course, that's very important. We've had, at the same time, Muslims and Jews in this clinic, Catholics, Protestants, atheists. And the idea is to totally respect other religions. But if people say, no, I'm not into that, I don't want to do 12-step because all I do is talk about God, we say, no, God is a concept for certain people, but for others, it's one with nature or with the cosmos or with the community, with other human beings. Some people's religion is interpersonal relationships and how we can develop them and feel this overlap of consciousness with other people. The collective consciousness, as Carl Gustav Jung said, feeling one with everyone else and with nature. That's the mystical or spiritual aspect that we work on here.
Oh, that's beautiful. And I wish you and your team the best of luck for the lives you'll have impacted and all the lives that will come to you all to be impacted at some point. Thank you so much for your time, Dr. Willis. It's been a pleasure. It's been a pleasure getting so much of your expertise, your knowledge, your experience, and also to understand so much about the work that you do over here. So thank you so much.
My pleasure, and thank you for everything that you shared with me. It was fascinating.
Thank you.